Everyone. Thank you so much for joining us today on our webinar, Influenza Disease and Vaccination during the COVID-19 pandemic. My name is China Locklear, and I will be moderating today's session along with fellow colleague Munez Akbaran. So we'll go ahead and get started. And just as a disclaimer, this webinar is supported by the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services as a part of a financial assistance award totaling at $2 million with 100% funded by the CDC and HHS, and these contents are those of the author and they do not necessarily represent the official views of or nor and endorsed by the CDC, HHS, or the U.S. government. And just for a little bit of background on the National Indian Health Board, and the NIHB is a 501c3 charitable organization created by the tribes over 40 years ago to advocate for improved health for our people. And our mission statement is established by the tribes to advocate as a united voice of the federally recognized American Indian and Alaska Native tribes. NIHB seeks to reinforce tribal sovereignty, strengthen tribal health systems, secure resources, and build capacity to achieve the highest level of health for our people. And just for some webinar protocols, if you could please keep your lines muted throughout the call. We'll have questions towards the end. This webinar is going to be recorded as well and will be posted on our COVID response website. If you have any questions or comments, like I said before, you can enter those in the chat box and we'll address those shortly after the webinar. And then there will be a post-webinar evaluation survey that will be sent out. Please do fill that out as that helps us best figure out what we can do to serve you guys. So we'll go ahead and introduce our speaker for today, Charlie Grenade with the CDC. She's a public health analyst, and today she will be speaking on the differences and similarities of the flu vaccine and the COVID-19 vaccine, as well as coverage and planning. And as I previously mentioned before, this webinar will be recorded, and this is the website that you can access it. Allow us about 2 days to get this uploaded to our website. And I'm going to go ahead and turn this over to Charlie.
Great, thank you so much, China. And good afternoon, everyone. Thank you to NIHB for inviting me here today. I'll be discussing influenza disease and vaccination during the COVID-19 pandemic, focusing on the similarities and differences between flu and COVID-19 disease and vaccination, influenza coverage, and influenza vaccination planning. Next slide, please. The primary objectives for today's presentation are listed here and include describing the similarities and differences between influenza and COVID-19 disease and vaccination, summary of current influenza disease burden and vaccination coverage for the 2019 to 2020 season, review of influenza vaccination planning, and finally, provide guidance for vaccination during a pandemic. Next slide, please. Next slide. So both COVID-19 and flu can have varying degrees of signs and symptoms, ranging from no symptoms or asymptomatic to severe symptoms. Flu and COVID also share a number of similar symptoms, including fever, cough, shortness of breath, sore throat, stuffy nose, body aches, and headaches. And both can also sometimes have no respiratory symptoms and just present with vomiting and diarrhea. However, one big difference is the loss or change in smell or taste. While this can occur in flu, it is much more commonly reported in COVID-19 disease. Next slide, please. There are also differences in timing regarding symptom onset after infection. For flu, symptoms typically develop 1 to 4 days after infection. For COVID-19 disease, symptoms, if they occur, may take longer to present and typically develop around 5 days after infection. However, symptoms for COVID-19 disease can appear as early as 2 days or as late as 14 days after infection. Note the time range for symptom presentation can vary. Next slide, please. For both COVID-19 and flu, excuse me, it's possible to spread the virus for at least 1 day before experiencing any symptoms. For flu, most people are contagious for about a day before symptom onset and may continue to be contagious for up to 7 days thereafter. However, for COVID, the length of being contagious is still under investigation. It is possible to spread the virus for an estimated 2 days prior to experiencing any symptoms or signs and remain contagious for at least 10 days following symptom onset. Furthermore, individuals who are asymptomatic may be contagious for at least 10 days after testing positive for COVID-19 disease. Next slide, please. Severe outcomes, such as hospitalization, are often associated with having one or more underlying medical condition. This figure shows the selected underlying conditions among hospitalized patients with laboratory-confirmed influenza compared with COVID-19, and uses data from CDC's flu and COVID surveillance systems. Note the X and Y axes represent the most common underlying health conditions and percent hospitalized respectively. Here we see asthma, cardiovascular disease, chronic lung disease, and metabolic disorders such as diabetes are very common among hospitalized patients in both flu and COVID. Though a risk factor for both flu and COVID, obesity is more common among COVID hospitalized patients. Additionally, hypertension and GI or liver disease are unique risk factors for COVID hospitalization, and the reasons for this are not yet fully understood. Next slide, please. In this figure, we see a comparison of pneumonia, flu, and COVID-19, or PIC, mortality. Note the percent of all deaths due to PIC is represented on the left y-axis, with the number of deaths presented on the right y-axis, and the x-axis denotes the MMWR surveillance week, numbers 1 through 52. As can be seen in this figure, roughly 13.6% of deaths occurring during the week ending December 26, 2020, or week 52, were due to pneumonia, influenza, and COVID-19. And among the 1,848 PIC deaths reported for this week, 1,215 had COVID-19 disease listed as the underlying or contributing cause of death on the death certificate. For comparison, only 3 deaths were associated with influenza, indicating that the current increase in PIC mortality is due primarily to COVID-19 disease and not influenza. Next slide, please. Next slide. So as you know, vaccines for COVID-19 disease and flu must be approved or authorized for emergency use by the FDA. However, for flu, multiple FDA licensed vaccines are produced every year to protect against the 3 to 4 flu viruses scientists believe will circulate each year. Additionally, currently available flu vaccines can provide immunity via inactivated or subunit vaccines, depending on the product type. Additional information regarding the seasonal flu vaccine can be found using this link. Because COVID-19 disease is a novel disease, vaccine developers, along with other researchers, have developed new vaccines specific to the SARS-CoV-2 virus, the pathogen responsible for COVID-19 disease. At present, 2 mRNA vaccines have been developed by Pfizer and Moderna and have received approval for use in the US under separate emergency use authorizations. Note additional vaccines to prevent COVID-19 that include protein subunit and vector vaccine designs are still under development. And additional information regarding available COVID-19 vaccines can be found on CDC's website linked here. Next slide, please. The initial supply of COVID-19 vaccines will be made available under an emergency use authorization issued by the FDA. Additionally, cold chain storage and handling requirements for each COVID-19 vaccine product will vary from refrigerated or 2 to 8 degrees Celsius to frozen, -20 degrees Celsius, to ultra cold, which is -80 to -60 degrees Celsius. Unlike flu, which requires a single dose administered for adults, vaccine administration for COVID-19 currently requires 2 doses to develop immunity, with doses separated by either 21 or more or 28 or more days, depending on which vaccine product is used. As such, second dose reminders for patients will be necessary. And note, because both doses will need to be with the same product, strategies to ensure the correct match of COVID-19 vaccine products and dosing intervals will be required. And finally, some COVID-19 vaccines may require reconstitution with diluent or adjuvant at the point of administration. Next slide, please. Next slide. To illustrate the burden of influenza disease in the previous flu season, CDC estimates the 2019 to 2020 flu season resulted in 38 million illnesses, which is roughly the same size as the population of the state of California. It also estimates 400,000 hospital visits, or the population size of Miami, and 22,000 deaths, which is enough people to fill Madison Square Garden in New York City. Next slide, please. Vaccination against influenza infection remains the best way to protect yourself against the flu, though only about half of the population got a flu vaccine last year. Despite low vaccination coverage, CDC estimates that influenza vaccination prevented 7.5 million illnesses in the US, which is more than the combined population of Kentucky and Kansas. It also prevented more than 100,000 hospitalizations and prevented more than 6,300 deaths. With this information in mind, how many more doctor visits, hospitalizations, and deaths could have been prevented, especially for the elderly and persons with comorbidities, if more people elected to get vaccinated? Next slide, please. As already mentioned, the best way to prevent seasonal flu is to get vaccinated every year. However, vaccination coverage, especially among adults, has historically been low, with much room for improvement. In this figure, influenza vaccination coverage by age group for the last decade is presented, with percentage vaccinated on the y-axis and the flu season on the x-axis. If we look at the 2019 to 20 flu season, we see an increase in coverage from the previous 2018 to 19 season. However, vaccination coverage was only 38% among those aged 18 to 49 years old, as shown here with the purple line, and only 48% for adults overall, shown here in the aqua line. Next slide, please. If we look at influenza vaccination coverage across the US, we can see substantial variability in adult influenza vaccination coverage by state or jurisdiction. Furthermore, in those states with the largest American Indian Alaska Native populations, denoted here with green arrows, adult flu vaccination coverage is low, particularly so in Alaska, with only 42.1% of adults vaccinated for flu. Regardless, all states and jurisdictions fall short of Healthy People 2020 goal of 80% of adults vaccinated for flu. Next slide, please. In this figure, flu vaccination coverage among American Indians and Alaska Natives, adults aged 18 years or older, by age group is presented. If we look at adult American Indian Alaska Native coverage, we see flu vaccination is low overall, with only 42.3% of adult AIAN vaccinated. Coverage is even lower for adults aged 18 to 49, represented here in the purple line. However, we do see a 7 percentage point increase in the flu vaccination for adults 65 and older from the previous 2018 to 2019 season, represented here with the orange line. Additionally, although not shown in this figure, the percent vaccinated for American Indian, Alaska Native, aged 18 to 64 with high-risk medical conditions is about 48%. Next slide, please. Data from one of CDC's flu surveillance systems is shown here and presents.
This is Richard from UAI. Good. I just want to make sure and call if we're still.
Thank you. Data from one of CDC's flu surveillance systems is shown here and presents age-adjusted influenza-associated hospitalization rates by race and ethnicity since 2009. The rate per 100,000 population is represented here on the y-axis, and the race ethnicity is presented on the x-axis. Non-Hispanic Blacks, non-Hispanic American Indian or Alaska Natives, and Hispanic or Latino groups have hospitalization rates significantly higher than non-Hispanic White and Asian Pacific Islander groups. Additionally, non-Hispanic American Indian Alaska Natives have the second highest hospitalization rates of 47.5% as compared to non-Hispanic Whites at 38.3%. Next slide, please. Although flu circulation has been limited thus far, flu typically peaks in February. Therefore, it is not too late for vaccination. Influenza vaccination will be an important strategy to decrease possible stress on our healthcare system by decreasing doctor visits and hospitalizations, as well as decreasing the number of people who will need flu diagnostic testing. Flu vaccination of healthcare workers may also reduce loss of staffing due to illness and further protect high-risk patients seeking care for other healthcare needs. Next slide, please. Flu vaccination will also prevent co-infection with both flu and COVID-19, which, although rare, has been associated with more severe adverse outcomes. And given the risk groups that have been identified for COVID-19 disease, influenza vaccination will be particularly important for racial and ethnic groups, staff and residents of long-term care facilities, adults with underlying health conditions such as cardiovascular disease, lung disease, asthma, and diabetes, and adults who are part of the critical infrastructure, such as those working in critical trades, agricultural work, and transportation. Next slide, please. Thus, flu vaccination will be more important than ever this season. At present, manufacturers of US licensed influenza vaccines have distributed 192.3 million doses of flu vaccine to the US market, which, as you can see from the figure on the right, are more doses than we have ever had in a prior influenza season. For distribution of all available doses, we will need effective outreach to persons at higher risk, planning for physical distancing and vaccine delivery, and to emphasize in our messaging that influenza vaccination should continue through the spring for the duration of the flu season. Ongoing COVID-19 prevention activities provide opportunities to share influenza prevention messages, and we will need to focus on American Indian and Alaska Native communities, given disparities in influenza vaccine coverage and COVID-19 morbidity. Next slide, please. Now, there are also many barriers to flu vaccination this year that were not present in previous years. Particularly, there might be fewer worksite vaccination clinics. In past years, approximately 16% of adults received their flu vaccination in the workplace. Other barriers also include people potentially avoiding flu vaccination because they feel unsafe going into clinics or pharmacies, or even people thinking that they don't need a flu vaccination this year because they're not going into crowded settings, among other reasons listed here. Next slide, please. In order to overcome some of these barriers, we need to ensure that we have coordinated messages across the healthcare spectrum, from CDC, providers, health departments, and medical professional societies on the importance of flu vaccination, as well as where patients can receive the flu vaccine. Providers can highlight the COVID-related safety precautions being implemented in their clinics so that patients feel safe in keeping their routine immunization appointments. This can be done on the clinic's webpage, on the pre-recorded messages that patients listen to when they set up their appointments, and in information sent to patients reminding them that it is time for their next visit. Creative approaches to addressing access and disparity issues, as well as common misperceptions about flu vaccination that are specific to your community, will be necessary to increase flu vaccination and confront persisting vaccine hesitancy. For patients who have recently lost insurance coverage or experience economic hardships, providers can give information on Medicaid, vaccines for children, insurance subsidies, or payment options. And finally, providers will need to continue vaccination efforts for the duration of the flu season, which means throughout winter and spring, for as long as the flu virus is circulating. Next slide, please. In anticipation of these flu vaccination activities that will be occurring during the pandemic, CDC developed guidance for safely providing immunization services. CDC's vaccination guidance during the pandemic follows the CDC framework for providing non-COVID-19 clinical care and includes considerations for use of personal protective equipment, discusses various clinical settings for vaccine administration, and has a special focus on priority populations for flu vaccine. The link shown here points to CDC's vaccination guidance during the pandemic. Next slide, please. Personal protective equipment will be necessary for vaccine administration. A face mask is recommended for all healthcare providers. Note, N95 masks are not recommended. Eye protection is recommended in areas of moderate or substantial community transmission and is optional in areas of minimal or no community transmission. Note, gloves are recommended for intranasal or oral vaccines, but are optional for intramuscular or subcutaneous vaccines. Next slide, please. It is also important to ensure physical distancing during vaccination visits, which means scheduling well and sick visits at different times of the day and placing sick visits in different areas of the facility or different locations. It also means ensuring physical distancing measures are in place, such as maintaining at least 6 feet during all aspects of the visit, which includes check-in, check-out, screening procedures, post-vaccination monitoring, as well as using strategies such as physical barriers, signs, ropes, and floor markings. It also means reducing crowding in waiting rooms. Next slide, please. For those of you who organize workplace vaccinations for their hospitals or community-level vaccinations in satellite, temporary, or offsite locations, CDC now has updated guidance on how to do this safely for your colleagues and communities. Please note the website link to the landing page located at the bottom of this slide. The website goes through planning activities, pre-clinic activities during the clinic activities, and post-clinic activities. It also links to the checklist of best practices for vaccination clinics held in these non-traditional settings. Next slide, please. The checklist of best practices is a step-by-step guide that helps clinic coordinators overseeing vaccination clinics held at satellite, temporary, or off-site locations and follows CDC guidelines and best practices for vaccine shipment, transport, storage, handling, preparation, administration, and documentation. Next slide, please. I'll go through the first section in the guidance as an example. This is the planning activities section, which covers leadership and staffing, clinical staffing, the vaccination clinic location and layout, and coordinating with various partners in the government, as well as nonprofits and private sectors. For the leadership and roles and responsibilities, designate leaders to oversee and coordinate the following pre-clinic, clinic, and post-clinic operations and tasks. Note backup leaders are highly encouraged. Administrative functions, EMS, logistical needs, identification of staffing needs, vaccine storage and handling during pre-clinic, during the clinic, and post-clinic, on-site infection control measures, site selection, public information and communication, and post-clinic evaluation. For staffing, ensure adequate staff has been secured to provide functions such as administering the vaccine, directing clinic flow, educating patients about the vaccine, implementation of infection control measures, eligibility and contraindications and precautions, and reporting vaccines administered. For vaccination clinic and location layout, consider populations to be served, environmental conditions, and individual site capabilities. Additional information regarding each planning section are available using the link below. Next slide, please. Also on the guidance for the large-scale vaccination clinics, we developed various flowcharts for different types of vaccination clinics. This one shows the vaccination clinic layout for an indoor or outdoor walk-through clinic. Even if the same space is used as a vaccination clinic held in previous years, it will likely need to be set up and function differently because of COVID-19 disease requirements. For instance, design the clinic flow so that it moves in one direction with separate entrance and exit areas. Implementation of a screening station at the entrance for temperature checks if required, and any screening questions for COVID-19 should also be included. Additionally, it is important to establish line queues that maintain separation between individuals, or to ask individuals to wait in their vehicles or another location until called. Within the vaccination area, if more than one vaccine is offered, different vaccines should be administered at different stations to reduce administration errors. Also, provide a separate administrative work area for on-site documentation of vaccination in the IIS or electronic health record, if applicable. If not done on-site, plans must be in place for how vaccination will be documented after the clinic. Finally, provide a private area where clients who experience acute adverse events after vaccination or who have medical problems can be evaluated and treated. Next slide, please. This slide shows a flow chart for a vaccination clinic layout of curbside or drive-through clinic, which may provide the best option for staff and patient safety during the COVID-19 pandemic. You'll note that in step 4, this option highlights that there should be an area to wait after vaccination, which is particularly important if the driver is receiving a vaccine. Next slide, please. In conclusion, it is going to be important to strongly promote flu vaccination, especially this season in the context of the pandemic, and particularly among our most vulnerable populations, such as American Indians and Alaska Natives. Help your patients find where they can be vaccinated, and to continue vaccinating for the duration of the flu season, which is winter and spring, and as long as flu is circulating. Additionally, communicate to your patients the importance of flu vaccination and reinforce the need to get both the flu and COVID-19 vaccine, as only receiving the flu vaccine will not protect you from the COVID-19 disease. Next slide, please. So I want to thank you again for allowing me to present this information to you, and myself as well as a few additional staff from CDC are available to take any questions that you may have.
Okay, there is question. We know that the best time to have flu vaccine is in fall, but how about COVID-19? Is there a specific time for it?
That's a great question. I'm going to defer to one of my colleagues, and if they have the answer to that. I'm not sure if if we know that answer yet, but I will defer to those who are more intimately involved.
Sure, thanks.
This is Mia Matnock. I'm with the federal entity. And right now there's no seasonal timing for COVID vaccine.
Okay, thank you. Do we need to have this vaccine annually like flu vaccine, or is it going to be a lifetime vaccination?
Hi, this is Jillian Doss-Walker, also with CDC, and at this time, that information we're not sure of yet. The clinical trials are still ongoing, and we hope to have more information in the future that will let us know if this, if these vaccines will need to be given on like as a booster dose, for example. So right now we don't have that information.
Okay, thank you. Why are there 2 doses for the COVID vaccination?
Again, this is Jillian Doss-Walker from CDC. So there are 2 doses. Well, currently the 2 manufacturers, there are 2 products that have been approved through the emergency use authorization by FDA. From their clinical trials data determined that 2 doses of the vaccine offered the highest level of protection. And so that is why there's a requirement for 2 doses for the Pfizer and the Moderna vaccine. There are other clinical trials that are still ongoing with other manufacturers that may have 1 dose, but those trials are not completed and they've not been approved for use in the United States. But the current vaccines that have been approved, they do require 2 doses, and we highly encourage and recommend that everyone complete the dose series and receive both doses to receive the full level of protection.
Thank you. What is the preferred method for Native American COVID-19 vaccination clinic, offsite or drive-through?
I think for this question, it may really just depend on your specific population, what vaccination sites are available, and what resources are available. So it's not really a one-size-fits-all situation. It's really how do you tailor it to your specific population that you're vaccinating.
Thank you. Why are N95 face masks not recommended?
So the N95 mask is not recommended as it by design, it doesn't protect the person wearing them from the virus droplets. So it is recommended to just wear the other, cloth or disposable face masks instead.
Okay, thank you. What sort of paperwork is mandatory for the patient in order to get vaccination for COVID-19?
This is Mia Matnock, again from CDC, and that also will vary with the clinic or site that you're accessing vaccine from. But each of those sites through their state, or in the case of some facilities which are set up through Indian Health Service, pieces of that information, not anything that personally identifies a person, but pieces of that information are collected in order that we throughout public health can understand what the uptake of vaccine has been in the population in general. And that is really important going forward in order to understand where vaccination efforts should be focused in order to increase access and uptake of vaccine so that everybody might be vaccinated at some point in the future.
Thank you. Next question. Do patients have to space out their flu vaccination and the COVID vaccination, or can I get the flu vaccine and COVID vaccine at the same time?
So if a patient wants to get vaccinated with both flu and COVID-19 vaccines, it is, you should not get them at the same time. Essentially, because of the type of the mRNA COVID-19 vaccine, the vaccine series should be administered alone or with a minimum of interval of 14 days before or after the administration of any other vaccine, which includes the flu vaccine.
Thank you. If individuals have received both vaccines, like flu and COVID-19 doses, and later come into close contact with the confirmed case, do they still need to quarantine?
Almia or Jillian, do you know the
Yeah,
answer?
sure. This is Almia again. And yes, the recommendation is still for quarantine. It's still actually to wear masks and practice physical distancing, good hand hygiene. And the reason for that is at this point, while we have evidence that the vaccine protects an individual from becoming very sick with COVID, we do not yet know if they may have sort of a very mild or asymptomatic infection and therefore still be able to spread to others. And I think that that's a piece of evidence, a piece of information that we're still collecting. Jillian, I don't know if you have anything else you want to add about that, to add to that question.
No, Ami, I think that covers it really well. Thank you.
And next question, why is it recommended that people get the COVID-19 vaccination if they have already gotten the flu vaccine?
It is recommended to get both the flu and COVID-19 vaccine because each vaccine is targeted to a very specific pathogen. So if you get the COVID-19 vaccine, it will protect you from COVID-19. It will not protect you from flu and vice versa. And yeah, I think that about sums it up. They're two very different vaccines for two different pathogens. So you should get vaccinated with both.
Right. And if individuals have already had COVID-19 and recovered, do they still need to get vaccinated with the COVID-19 vaccination if it's available?
Yes, it is still recommended that an individual who has contracted and recovered from COVID-19 to still get the COVID-19 vaccine. However, they do suggest waiting a 90-day period following complete recovery from the COVID-19. Okay. But either Almia or Jillian, do you have anything else to add to that?
This is Jillian. No, that's correct. I was going to say that that covers it. There, we have gotten a few questions related to that at CDC. I see another question here about if you get COVID in between dose, and again, as Charlie mentioned, at least waiting until the 14-day quarantine has passed to receive that vaccine, or if they choose to wait in that 90-day period that Charlie just mentioned until they've been fully recovered, then they can do so as well.
Thank you. And another question, if you are around others who have been vaccinated, you don't have to wear a mask, right? Someone asking.
I think right now CDC is recommending that you should still maintain the personal hygiene, mask wearing, and social distancing, even if you know that they've been vaccinated or you yourself have been vaccinated. It's just good practice. but Almea or Jillian?
Yeah, and just to reiterate with that, exactly agree. And the reason for that is that we don't know, even if you've been vaccinated, you may be able to still pass the virus through it, staying in your nose and throat from one person who is infected to another person without you yourself feeling symptoms. And so that's the reason for you wearing a mask, even if you've been vaccinated.
Thank you. At what point will individuals not have to wear a face mask after completing COVID-19 vaccination? Is there any messaging around this topic? I know that you briefly talked about it, but if you have more.
Yeah, I think that this is something that is still being studied to see if there will be a point or what the point would be where that recommendation, but for right now, we don't have that information and so are still recommending wearing masks even if you have been vaccinated.
Thank you. Has there been any cases of someone getting COVID-19 before they have taken the second dose of COVID-19 vaccination?
This is Jillian, and yes, there has been instances where a person has been vaccinated with their first dose and has contracted COVID-19 after. And again, as I mentioned earlier, the vaccines, the reason we have two is because to get that full level of protection. So that first dose provides, depending on which brand, a certain level of protection, but it's not going to be 100%. And so therefore, during that time, you could still contract COVID-19. And as Charlie mentioned earlier, we still would recommend that they receive that second dose after they have fully recovered from COVID-19 to be more protected from the virus. I don't know if Almia, if you have anything more, or Charlie to add to that.
No, nothing else, Jillian.
Okay, thank you. Why the CDC strongly recommends having flu vaccine this year to avoid further infection from COVID-19?
So the CDC is really pushing for individuals to get their flu vaccine, even during this pandemic where, there's less social gatherings, people are wearing face masks, they're, not participating in the normal activities they normally would. But at the end of the day, it's beneficial to everyone if you get vaccinated with the flu because it will really help decrease the burden on the healthcare systems. It will help reduce the amount of resources that go towards influenza diagnostic testing. It will help, especially with healthcare providers, if they're getting their flu vaccine, protecting their other patients who are coming in for treatment for other things, not COVID-19 related. You don't want to be spreading flu in a time where we're also in a pandemic. And, although it's rare, it is possible to get flu and COVID at the same time. And what limited research is available is showing that, individuals who have a co-infection are at an increased risk of very serious adverse health outcomes.
Thank you. Should individuals who cannot receive the flu vaccine or those with sulfur allergies not take the COVID vaccination?
I don't know, Mia, if you want to take that
I'm
one.
sorry, I cut out for a second. Can you repeat the question? So sorry.
Sure. Should individuals who cannot receive the flu vaccine or those with sulfur allergies not take the COVID-19 vaccination?
I would consult with your provider. There has been and is on the website for public review, though, focused towards clinicians about the contraindications for COVID vaccine.
Thank you. Another question, is flu a comorbidity for COVID-19?
That's a really great question. This is Almia again. And, you know, having lung disease, it is a risk factor for having more severe COVID-19 disease. I've not heard about flu infection itself discussed as a underlying reason or a health condition that would warrant, you know, increased risk or be thought of as a factor for increasing your risk with COVID. But again, that's probably something to discuss further with your provider, and a really good question.
Thank you. Next question, how would you respond to a person that states, every time I get the flu vaccine, I get sick? So what is the point of getting it? I found that people say this a lot and I'm not sure how to respond.
That's a very great question, and one that CDC is continually trying to answer and work with other partners, because, you know, the patient and provider interaction, you know, that's going to be very specific, and it's going to vary by, you know, where you're getting vaccinated. Are you getting vaccinated at a brand new site? Maybe it's a large vaccination clinic. Are you getting vaccinated by one of your regular providers, so you already have that relationship already established and can have an open conversation? The best, you know, depending on the type of person, you know, you could try and educate them on, you know, making clear to them to say, okay, well, you know, here's the flu vaccine. No, it doesn't cause the flu. You maybe have never had it, but, you know, think of people in your family. You know, do you live with small children or elderly, or your parents? You know, they're at higher risk. So if you, by vaccinating yourself, you're in turn protecting those around you. That is what we found to be a strong motivator, especially in some communities where vaccine hesitancy is high, is trying to promote that you're not just protecting yourself, but others, and then, you know, giving as much education as they are willing to listen to. But unfortunately, you will not be able to vaccinate everyone.
Thank you. Is there a grace period if you can get the second dose by 21 or 28 days?
Correct me if I'm wrong, Almea or Jillian, but I believe there is a 4-day grace period. So if you get a vaccine, your second dose, anytime, you know, 1 day to 4 days after what your next scheduled was to be, that is still valid. But if you miss that window, then I think you need to get revaccinated again. But I will defer to Jillian and Almea to correct me if I'm wrong.
Yeah, that is right up to the point of having to get a vaccine again. So we are really encouraging people, if they got the Pfizer vaccine, and this is why it's so important to know, even down to the brand of the vaccine you got, which is unusual for vaccines where, you know, usually you can just say, oh, I got the flu vaccine and the brand doesn't matter. But for this vaccine, it does. That if you got Pfizer vaccine, it's at 21 days that you should get the second dose. And for Moderna vaccine, it's at 28 days. And the reason that these times are quite strict at this point is because that's the evidence that we have. That's how the clinical trials were set up. And you are right that there is a 4-day grace period. So for some reason, if you, let's say you're living someplace and you know there's going to be an awful snowstorm tomorrow, and that was the day that you were supposed to get your second dose. So the clinic calls you in on day 20. That is acceptable, and you can get the vaccine in that 4-day or window. However, if for some reason you don't manage to get it in that 4-day window and several weeks have passed, I don't know what extenuating circumstances might happen, but if that does occur, that is okay. You can get your second dose whenever you can come in to get it.
Thank you. Is there observation period for the second dose as well?
Yes, there is an observation period, same as for the first. And also of note along with that question, it should be mentioned that if you had an adverse reaction to one of the two types of COVID-19 that are available right now, we would be concerned that you could for your second dose with either type of vaccine. And so that would be a contraindication. Again, something you'd want to talk to your provider about, but that concern about having a reaction to the vaccine, we are using sort of interchangeably, even though, for all other intents and purposes, we're very focused that, it's 21 days for Pfizer, but for that concern of a reaction, it would be interchangeable between the two vaccines. Does that make sense?
Thank you. I know that you answered this question previously, but several people asked again, what was the reason N95 are not recommended?
So I will give that over to Almeo or Jillian to add on to what I already gave.
I don't know if I have good information or can understand that question well enough to fully answer. So I'm sorry, I don't think I have anything to add.
Yeah, and this is Jillian. I was going to ask Charlie, I don't know if you want to just repeat what you had said earlier, and maybe the person might have missed the explanation that you had provided earlier.
To find the mute button. Yeah, essentially it's a focus on the respiratory droplets. It's just not as good at protecting the wearer as the other types of masks are. So it's just recommended to wear the medical masks or, face masks, something like that versus an N95 mask. And on top of that, it's also, there was the shortage of medical resources. So just wearing these other types of masks that are more sufficient in protecting the wearer, it also helps with ensuring that the amount of N95 masks that are absolutely necessary in other situations are still available.
Thank you. If a recipient of the vaccine were to have any allergic reaction or side effect, what does that timeline look like? Is it immediately or would it be days later?
Yeah, that's a great question. And in fact, the clinical guidance on the CDC website was just updated today with some more information around that. And the definition now for an immediate allergic reaction to vaccine or medication is any of those symptoms that you get with an allergic reaction, like swelling, hives, trouble breathing, that occur within 4 hours of vaccine administration. Now, if anybody has any symptoms later than those 4 hours, that would just not meet that definition of immediate allergic reaction, but it is something we definitely still want anybody to report. And anybody can report through VAERS, both a clinician as well as just a member of the public. We can put that in the chat, the link to VAERS, as well as for anybody who receives the vaccine. There's an app that one can enroll in called vSafe. It's completely voluntary and up to the patient. Hopefully providers everywhere are giving that information to their patients, that asks you questions daily, and then it becomes less frequent as time goes on. If you've had any symptoms from the vaccine. And that's, I think, another way to ensure that we make sure we're collecting any symptoms or adverse reactions from this vaccine. So that vSafe is an additional platform that's been added for COVID vaccines specifically. Thanks.
Thank you.
For
Thank
putting
you.
the Bears link.
Thank you very much. I see a comment, not a question. I just read it for you. There is a lot of misinformation about COVID-19, and I cannot find a simple explanation on the CDC website about how and why COVID-19 is unique from other coronavirus and influenza. I think this is needed, as well as why vaccination for both COVID and flu is needed. Thank you for this important presentation.
Thanks for that comment. We'll make sure that it gets back to our communications team. Thank you for bringing that up.
Thank you. And I don't see any more question for you. Thank you so much. Appreciate it.
Thank you again, Charlie, for this wonderful presentation, and to your co-hosts as well, helping out with the questions. We really appreciate it. As I mentioned before, we will be sending out a post-webinar evaluation, and we'll also throw that in the chat box here as well. If you could please fill that out for us. And then this recording will be on our COVID response website in about 24 to 48 hours as well. So thank you guys so much, and I hope everyone has a wonderful day.
Great. Thank you so much, everyone.
Thank you.
Thank you.
Thank you.
Thank you. Have a good day.